So my name is Lacey Nugent, and I will be presenting my case study. So the person I have chosen is Tyler, the Creator. He is an artist, and he does a lot of different things. He also designs clothes, a bunch of other stuff. If you've listened to his music or know anything about him, he is kind of vulgar, especially the beginning of his first stuff that he's released. So that's why I thought he'd be a good person to choose. The symptoms that I have diagnosed him with is aggressive and impulsive behavior. He has mentioned thoughts of suicide and homicide, mood swings, and delusional. You can see examples of these in his earlier music, especially on the Goblin album. So that is where I'm mainly pulling it from. I'm diagnosing him with adjustment disorder and with a focus of disturbance of conduct. So some symptoms that the DSM-5 mentioned for having this and diagnosing this is having emotional or behavior symptoms within 3 months of a stressor. In my initial report that I did on him, I mentioned how his father had left at an early age, which is very detrimental to a child's development as well. So that's one thing I thought would be appropriate for this disorder, along with behavioral problems, fighting, recklessness, vandalization, skipping school, and anxiety. So yes. And then for my psychoanalysis, I want to choose cognitive behavioral therapy as my approach for the therapy for him. It is defined by the Mayo Clinic as a common type of talk therapy or psychotherapy. You work with a mental health counselor, which is me, in a structured way, and you're attending a limited number of sessions. So CBT will help you become more aware of inaccurate or negative thinking so that you can view challenging situations more clearly and respond to them in a more effective way. So that's my main goal for him, is to be able to look at the negative things in his life and be able to respond to them in a more effective way, have more positive thinking, be able to alter the way that he's thinking about the life that he's currently living. And like I mentioned before, I believe that he has developed this disorder due to the lack of affection from the parent that was not in his life at a young age. So. And then as far as my treatment plan goes, like I said, I would really like to use cognitive behavioral therapy to address the behavioral issues, along with some of the thought process that he has with the things that he has mentioned in his career and in music. I also want to try using motivational interviewing. I thought that this would be really effective in order to change, or not change, but help view things in a different way, help him be able to view things from a more positive light and what life would really be like if it were the way he wanted it to be. And so I also want to work with a psychiatrist to prescribe antidepressants and anti-anxiety medicine. I know we just learned in class that some anxiety medicines can be really harmful, so I went to work with a psychiatrist to see if there were some other options for that. So yes, thank you.